Hello everyone, my name is Lena and welcome to my channel. I came here today to talk about my experience with Humira and having ankylosing spondylitis. Um, I was diagnosed with AS in May of 2019 after having many diagnoses of arthritis, starting with my back and also in all of my major joints, knees, hips, and shoulders. I also have a history of back surgeries where I've had 2 levels fused due to disc degeneration disease. If I had known that I had AS back in 2013, I probably wouldn't have had that surgery. I would have probably started to find the treatment to address the issue. But at that time, I did not have any knowledge of it. So I wanted to talk about my experience with getting the diagnosis and up to the first injection. When I got the diagnosis, I was a little bit in disbelief because I had been struggling for so long, and I was being told over and over again that that my arthritis and my pain was just related to weight issues and just arthritis, or that I'm getting to an age where things just hurt all the time, and that should just be my expectation and my quality of life. After having shoulder surgery on my right shoulder here, the doctor still did not find the issue where my pain was coming from. I was experiencing something between frozen shoulder and a rotator cuff, but he couldn't figure out what was the problem. And that is even after having surgery to perform investigative surgery to find out what the issue was. He could not give a solitary reason as to what was going on in his experience, but he did recommend that since I had a history of inflammation, to see a rheumatologist in his practice. So I made the appointment, and subsequently he released me from his care because he did not know how to help or what the issue was with my shoulder and why it did not improve. So that's going from December when I had that surgery until about May when I first saw the rheumatologist. And when I spoke with her and we had our first initial conversation and told her of the surgeries that I've had and how I got there, and with the different arthritis diagnosis, she was suspicious that I may have had AS. And then she sent me for further testing, and when we met again, reviewed the test, and she recommended me trying Humira since I seem to have all the symptoms and indicators that I have AS. So that was in May, and I had to wait a while for the pharmacy companies to deliver my medication to me, since it was supposed to be delivered by one pharmacy company, but then we found out that my actual insurance company does carry Humira, so I had to get it from them. So it took a little bit of a while to get the pen shipped to me, and I finally got it last Tuesday, and I set up time with the nurse last Friday to get my first injection. That's after. So I met with her initially the week prior to talk about ankylosing spondylitis, AS, and also to discuss any questions that we had about Humira and some of the side effects, since some of them are pretty significant, they go in the category of like common to moderate, then to serious. One of the most serious ones, side effects of the Humira injection, is cancer, lymphoma. So that's something to be mindful of if you're going to take this injection. We were also, me and my family sat down with the nurse, and we talked about all of our questions, and she gave us we discussed the more common side effects. I also have a history of migraines, so and being that headaches are a common side effect, that's something I had to particularly watch out for. If I'm going to be getting headaches, migraines could trigger nausea, and some of them were common symptoms, and just so I have an awareness of what the symptoms could be. We talked, and then when she came again the second time for my injection, we talked about the sites to inject and the step-by-step process of injecting yourself. And it was a little bit overwhelming. There's a lot of information to take in at one time, but all in all, I was able to give myself the injection with her help, with her instruction from my Humira ambassador. And so that was Friday, just Friday, and today is Monday. And the injection went pretty well. I decided to inject it into my the side of my abdomen, and it didn't hurt. I didn't leave any bruising. I didn't have any bleeding. I didn't feel sore or anything like that. So that was great. I was really happy about that. But in case you're wondering, this here is what the Humira pen looks like. If you're going to take the injection, you will flip. You'd have it this way. You inject yourself. First you take off, one would be down and two is up. And this is the button that you use to inject yourself. And when you press this into your skin, the needle comes from down here at the bottom, and then you'll hear a click, and then you hold it for about 10 seconds until that gives the medication time to go into your body. And then once you have that, you can dispose of it. And Humira was really great in providing to me a disposable unit, so I can dispose of all my my used pens, and they will send them back to the company for recycling. So that was pretty much my experience. It was a lot of information, a lot to learn. And one of the things I kind of did was I didn't go and research a lot of reviews of people on Humira, because I know that you can get varying responses to any kind of medication. It is case by case. You know, my experience may be different than someone else's, but I just wanted to document and have out here. If someone wants to get information, was looking it up and wanted to know about someone's experience with AS, they can. I'm just here. I'm here as a, just as a record that, I've taken it, and this is how it goes for me. So we'll see what happens in the next few weeks, on the next few injections as well, being that it takes several injections to build up into your system and then start to take effect. So I'm looking forward to that. I hope that I have a great experience with Humira, and I reduce my pain. I'm able to become more active. Because AS is pretty debilitating condition to have. So look forward to more. Thank you.